Okay, the history of quality. So we'll be talking about the history of quality for for the remaining 15 minutes of our class. So let's go ahead and talk about laboratory quality management system. So as defined by ISO 9000 series of 2000, quality management is a coordinated activities to direct and control an organization with regards to quality. So I guess I was able to define and clarified these things to you already. So quality, okay, quality is actually not a new thing anymore because these people, these are innovators of quality that started in the 1920s. Okay, in the 1920s. So these people, Walter Schuhart, W. Edwards Deming, Joseph Juran, um, Philip Crosby, and even Robert Galvin, all of these people, okay, they were able to innovate and actually propose a means on how we can actually perform quality checking and how we can maintain quality in our products, in all the things that we are doing in the laboratory, be it in the manufacturing, in the services. All of this are very applicable. Okay? So a brief history, okay? So please remember that in 1920, okay, Walter Schuhart actually proposed the statistical process control. So he is the one who actually have given the Levy-Jennings chart, okay? The Levy-Jennings chart, the dot chart was actually first created by Walter Schuhart. So Walter Schuhart is the one who actually created a statistical process onto which we will now be able to quantitatively measure errors. So mami-measure mo na yung errors that are happening inside your laboratory. Okay? Inside your laboratory. And then, eventually, in the 1940s, okay? In the 1940s, W. Edwards Deming propose on the other hand the continual improvement. That is the reason why we have this thing called um, opportunities for improvement. Ayan, yung mga opportunities for improvement, and also yung mga evaluation tools natin are all designed to foster and to actually pave way continual development in a particular organization. Okay? And then in Joseph M. Duran, okay, in 1950s, he proposed the quality toolbox. This is now a toolbox, meaning there is now a set of um, materials, tools that will be made used by the company that would actually guide them, then actually would standardize quality checking from one laboratory or one company from the other para hindi iba-iba. Okay? Para hindi iba-iba. So, and eventually, with the development of a quality toolbox by Joseph M. Duran, Philip Crosby, okay, um, Philip Crosby not implemented but proposed that quality would be a requirement. So quality now is a requirement. That's why, as you can see, from time to time there will be accreditation, there will be inspection in a lot of companies. So when I say companies, this would go as far as automobile, manufacturing, services, and even medical. Okay, even medical will also be included. Okay, that's why in 1980s, okay, in the 1980s, now because of the continuous development and continuous progress of all companies into making sure quality is being the one that would direct them and would also the quality in their company are also controlled. In 1980s, Robert W. Galvin, okay, set up the microscale error reduction so that people, okay, companies now would be able to identify, okay, they would now be able to identify and not just identify but eradicate the errors that are happening inside their companies and organization. Okay? So, having said that now, we have um, we have two governing bodies that are actually maintaining quality with regards to the clinical laboratory. We have the ISO, also known as the International Organization for Standardization, and the CLSI, the Clinical and Laboratory Standards Institute. So, sir, do we need to memorize the definition or the what does ISO and CLSI mean? Yes, you have to. Okay? So having said that now with regards to our ISO, your ISO's goal, okay, is to give us guidance for quality in service manufacturing and service industry. So these are actually more applicable not only to the laboratory but also in other industries, manufacturing, automobile, factories, food and beverage services, hospitality management. They are also under ISO. Even education, even academies, okay, are all being accredited and governed by ISO. So the broad applicability of ISO enables it um, to be one of the most used quality system in the most used quality system, not just here in the Philippines, but even worldwide. Okay, so these are being used by many kinds of organizations. What about your CLSI? Your CLSI is more concerned about the clinical setting and the laboratories. So they put up standards and guidelines for best practices for quality into making sure quality management is being made sure in the laboratories and hospital. So with regard to your CLSI, they give us a detailed, okay, they are giving us a detailed guidelines on how we can apply, okay, can we apply these concepts, standards and guidelines specifically to medical laboratories, okay, specifically to medical laboratories. And if I ask you now, which is more important in the laboratory, is it the ISO or is it the CLSI? What would be your answer? Which is more important, CLSI or the other one? Is it the CLSI or the ISO? Sasabihin ng iba, bakit mamimili kung pwede namang dalawa? The answer is both of them, guys. Ha? Both of them are actually very important. Okay? Your CLSI is very important. Same thing with your what do you call this? Same thing with your ISO. Both are actually important in the clinical laboratory. Okay? Both are very important in the clinical laboratory. So there are some documents that I want you guys to remember and I want you guys to take note. So the number one document are coming from ISO. Sir, what do we need to memorize here? The content. Ano yung general gist nung content nung document, the title of the document, and the series number. So for your ISO 9001 series of 2000, we have quality management system requirements. So this is a model of the QA in design, development, production, installation, and servicing industries. Your IEC 17025 series of 2005, this time naman, these are the general requirements for the competency testing within our laboratories. Okay? Within our laboratories. So what else? We also have your ISO 15889 series of 2007, which is pretty much concerned with quality management within the clinical laboratory. And I want to highlight this one, your 1589 the series of 2007, because this became the foundation of international medical quality management. So all of the medical laboratory or the clinical laboratory worldwide are actually following or will be accredited by your ISO. Of course, these are only exclusive, of course, to the only to the hospitals and laboratories that would actually um, apply for it. Okay, so particular requirements for quality and competence. So they are focusing on the quality management and the competence of the laboratories and also their staff. Okay? So the last part, okay, for the last time, we have your CLSI, we have your HS1-A2 entitled A Quality Management System Model for Healthcare. So this is very much similar to the ISO 15889 and ISO 9000. So it applies to all healthcare systems. Okay? And we also have your GP26-A3, which is now the application of quality management system model for laboratory services. Okay? Laboratory services. So this is pretty much concerned with the path of workflow of the quality system essentials within your laboratory. So there are a lot of CLSI documents. Okay? Um, and some of the CLSI documents would actually give us information also with regards onto how with regards to how a particular patient would prepare. Okay, we have your CLSI, GP46A1, yung mga ganyan-ganyan. So I will not be discussing that because that is not included in my discussion um, being our quality assurance that will be part of the patient preparation on your PMLSP2 already. Okay? So in summary, quality is no longer new. It's been here long ago, and it is a continually growing, okay? It's a continually growing industry because quality management, okay? Your quality management grew from good works of our innovators who defined them over 80 years ago. So from 1920, okay, from 1920 up until today, okay, up until today, we were now able to come up, okay, we were now able to come up with this following parameters and objectives onto how to check quality inside the laboratory. So quality management is applicable for medical laboratory as it is in manufacturing and industry. To be exact, quality management did not start in the medical laboratory. It did not start in the hospital. It started in the industry, in the product, in the manufacturing. Actually, pag dumating tayo sa Lean Sigma and Six Sigma, you would realize that it was actually during the quest for the best automobiles that Toyota tuloy, that the manufacturers, okay, was able to come up with your Six Sigma and your Lean system. So, so please do remember, okay, our laboratory is a very complex system and all aspect must be properly functioning to achieve the highest possible quality in the laboratory. So the approaches to implementation may vary from one location to the other, but at the end of the day, the goal is still the same. That is to have the best quality of your reagents, machines, personnel, but above all, the best quality of healthcare services that we are providing our patients. And of course, it would always start from the easiest one to implement so that we'll be able to have, we would monitor the steps of each of the processes. And ultimately, okay, all quality management system elements must be addressed. All of these 12 should be addressed so that the total quality management would be achieved within your laboratory. So are there any questions or comments so far? So thank you for listening, everyone. Thank you for listening. And now I am again opening the floor to your questions. If you have any questions, clarifications, please post it on our chat box now.